Welcome to watch instruction video for Confronting values in perioperative care. During this experimental learning session, nursing students will face ethical dilemma related to recommended clinical practice and patient's worldview. This simulation can be held at campus, in a classroom, or in an institution. The simulation case and debriefing after it will take about 1 to 2 hours. And during it, students will need to have a pair. So altogether, it's good to have about 2 to 6 pairs of students. There can be 1 or more teachers. Students will watch a video, so a classroom with a TV screen is needed, as well as a simulation video, some post-it notes and pens for the students, and Gallagher's ethical competencies written, for example, on a whiteboard. So, how to proceed in this simulation? For the beginning, teacher tells students that they are all welcome to the simulation. Teacher will also explain them the purpose of the simulation, and that through this experimental learning session, the students will become aware of their actions to other people. They will recognize an ethical dilemma. They need to make an ethically justified decision, and they will also understand that patients need in a context of perioperative care. It's also very important that students know that simulation is a safe environment and safe place to practice and to learn. Therefore, teacher lets students know that it's okay to make mistakes during the simulation. Teacher also supports students and makes sure they don't feel embarrassed. Teacher makes sure there is enough time for students to do self-reflection. And finally, the most important thing is that students have a positive learning experience. During the simulation, students will have roles, and teacher explains them what kind of roles they will play. There is a confidentiality between the students and the teachers in the simulation, and everything what is said and done during the simulation will stay in the classroom. In other words, nothing that was said and done during the simulation will go out of the classroom. Sometimes a consent form might be needed, especially if the simulation is recorded. Explain also the time frame for the simulation and debriefing after the simulation, and how the simulation is going to end. It's also important that nursing students have a chance to ask questions during the simulation. In this video, an adult patient comes to an outpatient's clinic to have a minor surgical procedure done. This could be, for example, a removal of a mole. Registered nurse takes the patient into a procedure room and the patient lies down on an operating table. Registered nurse starts to prepare the patient for the procedure by disinfecting the operating site. First, a nurse explains the patient that the disinfectant feels cold as there is some alcohol in the disinfectant. Patient is very much focused in the situation and raises question about the disinfectant. So, how to proceed with the simulation case? First, all the students watch the video together in the classroom, and after that, the students will take pairs. In each pair, one student plays nurse's role and the other one plays patient's role. The students watch the video for the second time now, and during that, they will immerse themselves into the given roles. After watching the video for the second time, students start to playing spontaneously how the situation continues. After some time, teacher will start debriefing the case with the students. Students have a chance to discuss freely about the experience they had as being a patient and how the nurse practiced during this simulation. After discussion, teacher raises questions based on Gallagher's ethical competencies and patients' answer, and students will answer to those questions by writing their own individual thoughts on a post-it note. Only one thought is written on one post-it note. Teacher has written Gallagher's ethical competencies with the questions on a whiteboard, and students will now locate the white post-it notes underneath each ethical competence question. Teacher summarizes students' thoughts in the end of the debriefing. According to Anne Gallagher, there are 5 essential elements of ethical competence. Those are care ethical seeing, care ethical knowing, care ethical reflecting, care ethical doing, and care ethical being. With these questions, the teacher can guide the students in this reflecting discussion. What did you see ethically challenging in this situation? What kind of ethical knowing is needed in this situation? How can registered nurse face patients' needs and opinions in these kind of situations? What can a registered nurse do to support and realize patients' personal needs in this situation? And what elements in registered nurses' behavior strengthens and undermines patients' experience of holistic safety? There are some risks and pitfalls in simulation sessions. Students will need time to think and to reflect the simulation case. Therefore, reflecting needs time, and it's a risk that there is not enough time for slow reflection. It's also a risk that there is not enough space for open and respectful discussion. And it's a risk that students may not feel safe during the simulation session. Teacher should be careful not to direct students' discussion too strongly. All these risks and pitfalls can be avoided by careful listening and discussion. Thank you.